Okay, let's dive in. Navigating Medicare for 2026. It can feel like a real puzzle. And that December 7th deadline for making changes, it's firm, miss it, and well, you might be stuck. So our mission today is pretty simple. We're building you a shortcut, focusing on maybe the most critical choice, finding the right plan and the right person to help you.
Yeah, it gets confusing fast. There are just so many pieces. Just for context, you've got your original Medicare, right? Part A for the hospital.
Right.
Part B for doctor visits, outpatient stuff. And keep in mind, the Part B premium is probably going up a little for 2026.
Okay.
Then you layer on the private options, Part C, Medicare Advantage that bundles A, B, often drugs, maybe some extras.
Like dental or vision sometime.
Exactly. And Part D, purely for prescriptions.
Yeah.
And then Medigap, the supplement plans, which help cover the costs original Medicare doesn't.
Got it. So knowing the parts is step one, but you mentioned the person, the guide. That feels like the real hinge point here.
It absolutely is.
Okay.
This is maybe the biggest secret to getting it right. Understanding who's actually selling you the plan.
Okay, tell us more.
Well, you basically got two types. The one you ideally want is an independent agent, sometimes called a broker,
Okay, why them?
because they work with multiple insurance companies. You know, Aetna, Humana, United Healthcare, Blue Cross, tons of them depending on your area. They can actually compare plans side by side.
So they're not tied to just one company's products.
Precisely. Their goal should be finding the best fit for you, comparing all the options available to you.
Okay, so what's the alternative then?
That's the captive agent. They work for and can only sell plans for one single insurance company.
So if I talk to one of them, I'm only seeing a tiny slice of what's available.
Exactly. And here's the red flag. If an agent seems really pushy about one specific brand, or they won't even discuss options from other carriers,
Run the other way.
well, just be very cautious. You want variety, you need choices to compare. Always aim for an agent offering that broad view.
So independence is key. But what else makes an agent truly an expert for 2026? It's not just about having options, right?
No, definitely not. They absolutely must be licensed and certified every single year. Things change annually.
Mm-hmm.
And ideally, they should specialize only in Medicare. Not trying to sell you car insurance one minute and a Medicare plan the next.
Focus matters.
It does. And crucially, especially for Medicare Advantage plans, they need local knowledge. Networks shift. Doctors leave. Hospitals join. A good agent knows what's happening on the ground right in your neighborhood for 2026.
That makes sense. So they check the local networks. What else must a good agent do before recommending anything?
Before they even whisper a plan name, they need to do a full Medicare needs assessment. It's fundamental.
Okay, what does that involve?
Two core things, minimum. First, the doctor check. You give them your complete list, primary care, specialists, everyone. They must verify each one is actually in-network for any plan they suggest.
No assumptions. Got it. And the second thing?
The prescription review. Same process. Give them your full list of medications. They need to check that specific plan's formulary that's just the list of covered drugs and tell you exactly what each med will cost you.
Wow, okay. That sounds like real homework for the agent.
It is, and it protects you. Also, be wary of pushy sales tactics. Surprise visits, rushing you, big promises of cash or free gifts just to sign up. Those are against the rules and big warning signs.
Good to know. Okay, let's shift gears a bit to the money side. Costs. If you're already on a plan, you get that annual notice of change, the ANOC letter, right?
Yes, must arrive by September 30th. It details all the changes for next year, premiums, copays, everything. Read it carefully.
But there's one really big financial change for 2026 affecting everyone with Part D drug coverage, driven by the Inflation Reduction Act.
That's right. This is a game changer for drug costs. It's the cap. For 2026, the absolute maximum you will spend out of pocket on your covered Part D prescriptions is $2,100.
Wait, $2,100 for the whole year, and then what?
And then your cost for covered drugs becomes $0 for the rest of the calendar year. Zero.
That's huge, especially for people with expensive medications. Massive relief.
It really is. It provides significant protection against catastrophic drug costs.
Are there other related cost limits we should know for 2026?
Yes, a couple others. The maximum deductible for a standard Part D plan is set at $615. And for Medicare Advantage plans, the maximum out-of-pocket limit for medical services, not drugs, but doctors and hospitals, is actually decreasing slightly to $9,250.
Okay, so $2,100 drug cap, $615 max Part D deductible, $950 max MA medical out-of-pocket. Good numbers to keep in mind.
Definitely. Track all three.
So pulling this together, you've got Medicare Advantage, Path A maybe, lower premiums usually, bundled benefits, but you must verify your doctors are in that specific, often local network.
Correct. Network is king with MA.
Or Path B Original Medicare, maybe add a Medigap plan for predictability, plus a standalone Part D drug plan. More flexibility with doctors nationwide, potentially higher total premiums, but very predictable bills.
That's a good summary. Flexibility versus potentially lower monthly cost, but with network limits. It's a trade-off you need to weigh based on your needs.
Okay, final reminders then. That deadline again.
December 7th. It's absolute. No wiggle room.
And document everything with the agent you choose, right? Premiums, the caps we discussed, written confirmation about your key drugs and doctors being covered.
Absolutely. Get it in writing or clearly documented in the enrollment.
All right. So maybe a final thought for you, the listener, to chew on as you navigate this.
Beyond just the costs and the networks this year, think about next year. Does the agent you're considering commit to helping you review your A&OC letter next fall?
Interesting point. Are they just transactional or are they a long-term partner?
Exactly. If they don't promise that ongoing support, that annual check-in, are they truly invested in your long-term health coverage? That continued commitment, that's often what separates a good agent from a great one.